Dr. Carol Racer Cordero has dedicated much of her life to serving Pinellas County, Florida.
Currently, I'm a professor at St. Petersburg College in the Public Safety Administration program, and I work there full-time with students, and it's a job I absolutely love. My background is in law enforcement. I served for 25 years with the Pinellas County Sheriff's Office. And some of the things I like to do for fun is I like to travel, and probably my top one is to walk my dog Zorro.
In 2018, she developed pain in her lumbar spine.
I experienced some back pain and I was concerned about it, and I went and got an MRI from a service provider. And that service provider told me I had a herniated disc, but gave me a list of doctors to refer me out to. And I was looking for more personalized service because I have had 2 neck fusions in the past, and I was concerned about finding the right doctor and the right fit for my situation. I think my lower back pain is partially due to the aging process. I'm 60 years old now, so that's a lot of decades behind me. And for 25 of those years, I served as a law enforcement officer, and those gun belts are pretty heavy to be wearing. I think it's a combination of many factors that brought on my lower back pain, and it would hurt while I was sitting, while I was standing, but most of all when I was walking, going up and down stairs. Initially, it was just in my back, and I thought maybe over a period of time it would just go away, but then it started the pain to extend down my left leg slowly, and over a period of time all the way down to my ankle. At that point, I knew I had something pretty serious and needed to do something about it. I was recommended by another service provider to get a shot to see if that reduced the pain. However, in the past, I had had a shot when I had my neck fusion, and I had a reaction to it. So I was afraid really to go that route.
She shares some background on her 2 cervical spine fusions and why she was looking for alternatives when it came to treating her lower back.
Both of them were the result of car accidents. The first one is when I was serving as a deputy sheriff, and I was on an on-duty car accident, and I had to have my neck fused as a result of that accident. The second one occurred while I was working at St. Pete College. I was driving on my way home, stopped at a light, and I got rear-ended by a van. As a result of that, I had to have the neck fused again. It was a long rehab program. I had to go through about 3 months of going 2 to 3 times a week. I didn't want to take that much time off from work, and while I know it's not an easy fix, I wanted to find the right fix that would work with my lifestyle and my job.
Knowing she didn't want fusion surgery for a 3rd time, Dr. Racer Cordero tried some at-home remedies, followed by a call to the Bonati Spine Institute.
It only alleviated the pain for a very short period of time, and then it came right back. I actually saw a commercial about the Bonati Spine Institute, and then I decided to go on the internet and research it. And one of the things that really caught my attention was the Institute's experience in doing these type of surgeries. So I thought to myself, they must know what they're doing if they've done that many, and I made the call. They asked me to send my MRI, and they'd have a physician look at it, and then they said a physician would call me, and in fact, I was very surprised. He did call me and explain to me what he saw on my MRI.
Consultation day is an extensive process at the Institute. Guests meet with patient advocates, nursing staff, take a trip to the imaging center if need be, complete any pre-op testing, and finally, a one-on-one with a Bonati surgeon.
And then I met with the nurse that looked over my records as well as my MRI and said that I would be meeting with a doctor. And he reviewed my MRI and recommended that I have surgery. Another feature of the Bonati Spine Institute was it was one-stop shopping. They did all the labs there, the MRIs, the x-rays, and that was very convenient to have that type of service provided.
Though surgery of any kind can be scary, the staff at Bonati ensure guests are comfortable throughout their entire process. Once surgery is over, guests complete a walking protocol, and they're encouraged once they return home to continue that walking regimen.
I came early that day and was met by the staff. The nurses were just outstanding, making me feel comfortable. and putting me at ease that everything was going to be okay. The surgery went great, and it didn't seem like I was in recovery that long before I was able to go home. After surgery, I was returned home, and I stayed out of work for about 2 weeks, mainly because of driving in a car and avoiding the chance of having an accident in which I could have my back damaged. But after 2 weeks, I felt great, and I went back to work full time. My activities started to resume of what I used to do. I started walking my dog a lot. In fact, when we go on the weekends, we walk on the trail about 4 miles, and there's no way I could have done that before. I live in a house that has a lot of stairs, and before it was painful to go up and down them, and now sometimes I'm kind of running up and down them either to get my phone or to get something from upstairs.
In addition to physical pain relief, Dr. Racer Cordero notes the psychological and emotional relief from eliminating chronic discomfort.
I think that when you get rid of pain, you have a better focus through all aspects of your life, whether it's your personal life or your professional life or even leisure. You don't feel like you're being weighted down by something that you can't control. So I'd say that it improved every aspect of my life. And you feel better and you feel like doing more. When I had my neck fusion, I think that was a little bit more detailed in the amount of time I spent in the operating room. What stood out the most is the length of time for rehabilitation. That was a must when you have a neck fusion. In comparing that to the Bonati Spine Institute, I didn't have any rehabilitative needs to have to go to during the week. It just healed on itself, which that's what I was really looking for. We're all looking for simplified ways in life, and with the Bonati Institute, they gave me that opportunity. If I had anyone that came to me saying that they had back pain, in which I have had a friend already, I would refer them without hesitation to the Bonati Spine Institute because I know that they would take very good care of them. I believe they would help resolve their problem and pain. I'd like to thank the staff of the Bonati Spine Institute because they really made you feel like you were important to them.